I'm Emma Kelly. Today we're going to be treating hair loss using the T-Lab PRP kit, your protocol. Something I love about the kit is everything is included in the one kit. So first step is getting our sand sorted and preparing our area. So these, the ones with the orange lid, are going to be the two that we collect our blood with, 10 ml in each one. Next is our straight needle, getting that prepped for our patient. So over to taking the blood now. So we've collected 20 ml of blood, 10 ml in each. We just do a quick inversion to make sure we mix the anticoagulants, and over to the centrifuge we go. So first step is to make sure that we've got the speed and the time correct. To adjust the speed, you hit the speed button and then where you need to go. So 2,900. Next is making sure the time is correct. Press the time button and go down for 4 minutes. Next, we need to open our centrifuge. We do this by hitting the red lift open. Always making sure that our tubes are filled exactly the same and popping opposite each other. Next is to close the lid and hit the green start button. While the PRP is spinning, we use this time to prepare. We have our stand with our resuspension tube. We will be putting all the PRP in there. We have our 5 ml drawing up syringe, our drawing up needle, our aerating needle, our 1 ml needle for injection. The kit does come with a yellow 30 gauge, but today we're going to be using our small 32 4mm meso needle. So let's see what PRP we got. So once it's spun, we're looking for 4 to 5 ml of PRP in each tube. The first step is to put the aerating needle in. I recommend putting this on the side and making sure that the needle is not touching the PRP. Next step is our 5 ml syringe that we're going to use to draw up with our drawing up needle. We are going to take off the pink part, and this can be discarded. We are attaching that to the luer lock of the 5 ml, taking off the protected cover and using the next part to draw up. Making sure that we get it into the middle of the tube. Next part is pushing it through the bung. This can be a little bit tricky, so always making sure you lose a bit of leverage of your arm. Also making sure that we do not touch the needle while doing this. I suggest going slightly higher than the red and drawing up slowly. At any time, if you see any red blood cells coming up, stop and adjust the needle. And that's where I'll stop drawing up this one. Now we're going to get our resuspension tube ready. Always making sure we put this one to get the air out. The reason we use the blue suspension tube is to make sure that all the platelets we put in are all equal. Softly put the PRP into the tube. We're going to do the same for the other tube. I always make sure by the end I just readjust and draw up really slowly. In the case that you do get a few red blood cells, that's fine. Now for our last part. Nice and slowly so we do not cause any bubbles or foam. Now we can remove the needle and discard. We are now going to be drawing up at the resuspension tube. Now quick up and down just to make sure all the platelets are spread. Now we attach the 1 ml syringe that we're going to use to inject. While we're doing this, making sure that you draw back really slowly to prevent any bubbles. We undo that and we attach our mesoneedle. So first steps is always making sure that your patient has washed their hair prior to coming in. I like to clean my patient's hair with Corhex and then alcohol. I like to go through where I want to inject and 1 centimeter radius. I don't like to use numbing cream due to it being really hard to get out their hair, and I wouldn't want to be injecting it back in my patient. So we've got our 1 ml, 32 gauge, 4 millimeter needle, meso. All right, we're going to get started. I like to space them out about every 1 centimeter. So I'm going full net depth of the needle, 4 millimeter. Once we're finished with our 1 ml, we go and draw back out of the resuspension tube. Each time I like to change my meso needle just to relieve the pain of the patient. So I don't clean off the area after I've injected. I like to leave it on there and after I give it a good massage. So we're going to start the other side now. As mentioned, we're spacing it out about 1 centimeter per injection. Through the hair and 1 centimeter around. Once I've finished doing all the injections, I topically apply some PRP. I ask the patients to not wash their hair for at least a day. And the best part of the treatment is their head massage. We recommend doing this treatment every 4 weeks for a minimum of 3 treatments. Thank you for watching this video on T-Lab PRP for hair loss.